To create a digital denture in a dental office, there are several important factors to consider. The first step is to decide whether to use the patient's old denture or a thermoplastic denture tray, especially if the patient doesn't have a denture or if the existing one is in poor condition. Choose the appropriate impression material and reline the denture if necessary. Then follow the scanner protocol for accurate denture scanning. Different scanners have different modules for various types of work. You need to decide whether you will be using the relined denture as your model for the work, or if you will scan the gums and use the denture only for the bite. Then spend additional time to ensure that either the denture or the gum is captured accurately. Review your denture scan to make sure it is fully captured. As you can see here, there are some open meshes. Make sure to scan those gaps to reduce potential issues with the final product. On this lower denture, the retro molar pad hasn't been fully captured. Try re-impressing the area to ensure it's properly recorded. If the mesh has a small opening, it can often be fixed using CAD software, or some scanners can automatically correct it during the file refinement process. There are many software options for designing dentures, such as ExoCAD, 3Shape, and Dental Wings, which are commonly used in dental labs. However, these software programs can be expensive and take time to learn. A more efficient and cost-effective solution would be to send your design to our lab, Newpar's Dental Lab, where our professional lab technicians can handle the design for you. When printing, please inform our lab about the type of 3D printer you have in your office, and we'll help you prepare the file for your printer. If you don't have a 3D printer yet, here are some models we recommend for you to consider. Your printer comes with software called a nesting program to prepare the file for printing. For example, the Alpha nesting software works with the Accurata 3D printer. To use it, you just drag and drop the designed denture base into the program. When placing the supports, make sure they don't go inside the teeth holes and try not to put too many on the intaglio surface, as they can be hard to remove without damaging the denture base. As you can see here, we used AI to position the denture and add the supports. The supports are typically placed at the border of the denture, making them easier to cut and polish. You can also place some on the palatal side, but avoid placing them inside the denture holes, as this can make it difficult to position the teeth properly. Here we selected the Voco denture-based material from the library, with fine quality. To prepare the file for printing, you need to slice it. In the final window, make sure to click the material box to confirm that you have selected the correct material. Since the printer works layer by layer, taller objects take longer to print. The quality of the print also affects the time. A finer micron setting results in better quality but takes more time, while a larger micron setting reduces both the quality and the printing time. Finally, click Send to transfer the sliced file to the printer. Here is another nesting software for the Sprint Ray 3D printer. As you can see, the principles of all nesting software are the same, though they may look different. Just like the other one, position the denture base, and it's recommended to place it at a 45-degree angle. Again, ensure the supports are not inside the teeth holes and avoid placing too many on the intaglio surface. Let's talk about the material library. Some printers, like NextDent, have a closed library, meaning they can only print with NextDent materials. On the other hand, printers like Accurata, Shining 3D, and Asiga are open systems, which means they can print with a variety of brands and materials. SprintRay has a limited material library. Before purchasing a 3D printer, it's important to consider the primary tasks you will use the printer for, as well as factors like price, printing time, and print quality. For denture bases, we found that the V-Print denture base from Voco is a better option for printing. Most 3D printing resins require rolling to mix the material, which takes time. However, many Voco resins, like the denture base, do not require rolling. If the bottle is square, it typically means there's no need to roll the resin. If the bottle is round, it's usually a sign that rolling is necessary. Now that the file is sent to the Accurata 3D printer sole model, you'll see the estimated print time is 4 hours. This is because we are printing 4 denture bases. To fit all 4 on the build plate, we had to position them vertically, which results in 1,051 layers. If you want to reduce the printing time, you can position the denture bases flat or horizontally, which will reduce the number of layers and speed up the printing process. Additionally, as mentioned earlier, lowering the print quality to standard will also help reduce the printing time. To print the teeth, follow the same printing process as you did for the denture base. After finishing the print, we remove the supports and wash the resin with alcohol. Next, grind away any remaining parts of the supports and prepare the teeth for placement. We test the teeth in the denture base holes to make sure they fit easily, without any leftover support or material inside the holes. If you feel anything blocking the teeth from fitting, use a scalpel or handpiece to remove it. Keep the support on the teeth to make it easier to handle and to help hold them in place. You can use CediTEC from Voco to bond the teeth to the denture base, or you can use the same denture base resin for bonding. Place a small amount of Voco denture base resin in the holes and press the teeth into place. Make sure to use enough resin to avoid air bubbles underneath the teeth, as these can weaken the bond. Press the teeth into place and clean off the excess resin with a microbrush. Be careful not to let the resin spill over onto the occlusal surface. Make sure to fill all the gaps between the teeth and check each one to ensure they are fully pressed in. Use a proper light cure gun and ensure you are wearing the correct eye protection. Fill any bubbles and prepare the denture for the post-processing light cure unit. Post-curing is crucial for all 3D printed resins after printing, as more than 70% of the curing happens in the post-cure unit. Most printing companies use their own machines for this step. For a standard brand, curing a denture usually takes about 20 to 30 minutes. The Otoflash is designed for quickly post-curing resins using light-induced photopolymerization. With the Otoflash, you can post-cure a denture base in only 3 minutes. The nitrogen feature helps create a smooth, hard surface that is non-sticky. Call us at Newpar's Dental Lab if you need assistance with CAD designing or help finding the best printer or intraoral scanner that suits your clinic.
If you require technical assistance with scanning, 3D printing, or designing, please contact us at Implant Dental Lab Services. We will create and send you a short instructional video at no charge to support your needs.